and be mindful of time to make sure we have enough time to go through this. So welcome everybody to our second to last Alumni Speaker Series event for the 2021-22 academic year. We have one more next week. It's been a busy month, an OT month. So Larissa is our third and final presenter in April to round out OT month, and we're so excited to welcome her back. She's done so much for the department and giving back and educating our students. And we were just reminiscing about how way back in 2011, Larissa was the original founder of our Facebook group, which now has, I think, close to 500, if not over 500 alums. And that was way back when like Facebook was the only thing we had. And it was kind of, exciting and new, and it still serves an amazing function for us, but she's the admin on there. So, hugely connected and, deeply appreciative of all the work Larissa's done for us, including what she's about to do for us this evening in her presentation. So as you all know, because most of you have been to more than one of these, you've heard, and Emily gets the award for all the events. So happy to always have you here. So you've heard my talk before, but I love to say it for the purpose of, honoring the history and how this got started, and setting the context for tonight and what we'll talk about. That this series came in the midst of the pandemic, right? It really started to be conceptualized in the fall of 2020. Wow, yeah, fall of 2020. And from our amazing now seniors, Emma and Julia, who you'll hear from this evening as facilitators, really looking for additional ways to further their education, learn about some non-traditional areas, innovative practice. Brought that to Jenna, then sort of came to me, which married with my vision of deepening alumni connections as an alum myself, and really looking at ways of engaging alums, and in a critical time where we all were looking for more connection. So, this sort of perfect timing of thinking about, this exciting way, and Zoom was still kind of new at that time too. It was like a novelty to get to do this. So it was this way to bridge time and space and, find each other and build this great community. And we had an amazing first semester, spring 2021, with 17 speakers in 15 weeks, which was unreal. We slowed the pace this year so we could better manage it, with one speaker a week over the course of the academic year. And except in April, like I said, we've had 3 speakers for OT month, and we'll have one more next week. So it's been a huge testament, one, to the vision of our students, how they're change agents, how they can bring an idea forward and we try to make it happen and bring it to life. And also a testament to our alums and our amazing community that we have, that so many of them stepped up. I mean, and when we put the call out in January 2021, we were had more alums than we knew what to do with, which was such an amazing problem to have. And the same thing happened when we put the call out last fall, that the series filled within like a week. So it's great. Our alums are our treasure, and we're so proud of them. And it's always amazing for me to hear what everyone is doing, and just welcoming them back and connecting them with our current students so that they can learn from and with each other. Some of these have led to fieldwork opportunities, networking. So it's just been an honor to watch this grow and develop over time. So it's so great to see so many alums on tonight. Hi, Brandon. It's so nice to see you. All right, well, you didn't come here to hear me talk, so I'm going to turn it over to Emma, who is facilitating this evening, and she will talk a little bit about accessibility, access, and then introduce our speaker. Thanks.
Thank you, Julie, and thank you all for being here. Thank you, Larissa, so much for your time tonight. I'll start us off with some access info, and then we'll get into Larissa's presentation. So for Zoom closed captioning and the live transcript, you can click on CC live transcript at the bottom of the Zoom window next to the reactions button, and 2 options will pop up. Option 1, show subtitle, which will make captioning appear at the bottom of the screen. And to turn off those closed captions, you can click on CC live transcript again and then hide subtitle. The second option is view full transcript, which will make the live transcript appear on the side of the Zoom window. And if you want to view the full transcript and the chat feature at the same time, you can go to the top of the live transcript window and click on the downward facing caret, aka Karen, best part of speaker series every time, and then click pop out, and then you can move the live transcript anywhere on your screen. For the chat feature, the chat's at the bottom of the Zoom window next to the participants button, and similar to the transcript, if you click on the chat button and then the caret at the top of the chat window, you can choose to pop the chat out and move it all around your screen. You're welcome to use the chat feature throughout the presentation, whatever way feels comfortable, and during the Q&A, we'll take questions through video, audio, the chat, however you want to do it, whatever feels most comfortable for you. We are recording this session and we'll post it with an edited full transcript to the virtual OT site for current students, faculty, and staff to access. If you don't fall in one of those categories and you want a recording, let us know and we'll find a way to get it to you. But tonight is our 6th speaker series event of this spring semester, and we are so lucky to hear from our alumni, Larissa Pauly. Larissa graduated from ICOT with her bachelor's in 2010 and her master's in 2011. And since that time, she's worked in acute care, outpatient hand therapy, mobile Medicare B services, home health care, and has completed assurance evaluations for determination of medical necessity for state level LTSS program. So basically everything. She's a little bit of everything. Larissa currently works as the strategic lead out of network manager for Signify Health, and she lives outside of Philly with her family. So Larissa's going to start us off with an overview of her work and her experiences, and then we'll have our Q&A period where you can all ask whatever questions you might have in a nice informal conversation. So without further ado, I will turn it over to you, Larissa, to get us started. Thank you again.
Thank you so much. Thank you. So I put together a quick little slide deck just to kind of organize my thoughts, which Emma is going to share with you guys. And I figured this could kind of be the best way to kind of group like my history with OT, kind of like where I've been, where I'm going, everything in between. And then we can just have a kind of like chat question and answer session. So by all means, like feel free to jump in, ask questions. This is a great, like, I really love what I'm doing now. And I love that I can use my OT background to do it. And that my company so appreciates like my skill set that I brought to the table. So if we can go to slide 2 here. Emma, are you able to advance it?
It looks like Emma froze, maybe.
All right, well, maybe I can share my screen here. Hold on. I'll share it, but then I can't see all you guys.
I think Emma's back. Nope. Oh, we lost Emma.
Share it, Larissa, if you need. If Emma's not here.
Can you guys see my screen?
Yes.
Yeah.
Yes. Okay, perfect. So we're just going to go with it.
Okay.
All right. So non-clinical careers for rehab professionals. How do we get there? What kind of careers are out there and everything in between? This is going to be a brief overview of everything that of me, my career, kind of, you know, what's out there and where can you get started in finding information on these careers. So a little bit of my background, I am from upstate New York, in a little town just kind of in between Auburn and Ithaca. I'm a local girl. Like I said, I graduated with my BS in 2010, my MS in 2011. I've lived in a whole bunch of different places, Belgium, Annapolis, Maryland, Raleigh, North Carolina, and right now I'm in Lansdale. And this is my family. So my husband, my little baby, who's now 3, and my mother-in-law at my master's graduation way back in the day. So what have I done with my career? I've worked across almost all practice settings. I did my clinical rotations in a SNF, transitioned into acute care right out of school. And I was really lucky. I worked in a very supportive hospital that loved to do program management. I had a great team. We really fostered growth and kind of everybody had their own specialty, and it was a really awesome place to work. I kind of fell into trauma and hand therapy there, where I then created a bridge program between inpatient and outpatient to provide like a continuum of care for these patients who had trauma in their upper limb. We did a little bit of home assessments, what we called PT 360. So we'd see patients within their homes prior to surgery, see them in the hospital, and then see them in their homes for a session or two before they went to the outpatient clinic. I covered one of my friends who I actually went to OT school with at IC. I covered her maternity leave for early intervention for a little bit. And then I also did some insurance evals, which I'll talk about in a minute, and some home health, mobile outpatient, and now I'm kind of in the non-clinical world. My certifications, I've got kinesiotaping, certification. I've also got my CPAMs for modalities. I really love working in orthopedics, women's health, talking about sleep and OT and returning to safe sexual activity following injuries. So that was kind of like my bread and butter, loved being in those areas. And so my journey into the non-clinical world kind of came at an uncertain time. We had to move from my job where I was a staff 3 therapist at a hospital, and I had had a really long career there. Most of my career was at that facility. And we had moved to a new area that was very saturated in OTs because there were 2 OT schools, pumping out new graduates left and right. And really the only thing that was available at the time was PRN work. So I had to piece together, probably 3 PRN jobs to try to get some hours and get some pay. And then the pandemic hit and everything kind of screeched to a halt. So I kind of had to go back and think about what I've done in the past and where my skill sets really lie to figure out where I wanted to go in the future. And I had to look at what I had in a whole new way and through a new lens with the pandemic. And it brought me back to kind of when I was in OT school, and I had a professor, Judy Gania, who would always tell me, like, there are opportunities out there. You just have to speak to what you can do as an occupational therapist and how you can help a company, because they might not be looking to hire an OT, but they could definitely use OT skills. So that was kind of just always resonating in the back of my brain. And I had to go back to the drawing board and figure out what I like to do, where my strengths lie, and how I can market myself as an OT. There's always that little bit of burnout that can happen when you're doing stuff back to back to back to back in the clinical world. And there was a lack of advancement, like especially in the hospital that I was in prior, everybody was a lifer there. So as soon as I made it up to staff 3, I wasn't going any further than that. And being the person that I am, I always like new challenges and doing new things. So I kind of had a, fork in the road. Do I continue down the traditional OT path that's safe? It's kind of everybody knows what you do, continue to build my career set, be a CI to students. Do I go the traditional way, or do I kind of like veer off this path and go into the unknown, which is ultimately what I decided to do because I like a challenge. So my first non-clinical career opportunity was with DME Consulting Group, which is now called Periscope. I did a whole lecture on it, the first alumni speaker series. So if you're interested in that, you can go back and kind of watch that presentation. Again, it was a PRN opportunity. Basically, they had members of a long-term services and supports, PA Health and Wellness's insurance. And these were individuals who weren't on a therapy caseload, but were requesting either equipment or home modifications. And I would go out there as kind of like a blinded third party, non-biased person and say, hey, actually this piece of equipment would be better for you, or I think you could do this in a new way. Kind of using my therapist skills to best look at a situation and determine which is the best way to attack this, from an insurance point of view, what would they qualify for? And that kind of got me into understanding CMS's rules and regs, which really applied to my skill set. And I basically came across Signify Health, and they had a posting for a post-acute network operations specialist, which I know is a mouthful, but that is a role where Facilities, hospitals opt into Medicare's BPCI program, which is a bundled payment program, and in which the hospital says we take financial responsibility for these patients and their outcomes, and we want to improve these outcomes. We think we can improve their outcomes. And if their outcomes are improved, CMS gives you, a higher reimbursement rate. We're kind of seeing in the healthcare field right now that transition away from fee for service to more of a holistic view of payment. So if you think about it, the past several decades have been healthcare gets paid to do things to you. Let's look at this in a new way and see what is the best way for the patient, specifically looking at them as an individual. So the PAOSs basically help the hospital build a post-acute network where they really eliminate those communication silos between one setting and the next. So between the SNFs and the home health, and they work on that smoother handoff, and they say, okay, so if we want to improve outcomes on COPD patients, what programs can we build with therapy? How can we monitor them, medically and reduce those readmissions we know, which can be very costly, and get the patient home sooner, and because you want to be in your home environment. So having that warm handoff between each setting has really improved patient outcomes. So I was hired under the PAOS role, but I was a special teams PAOS, which has now turned into out-of-network management. So basically my role at the time was when somebody goes out of this preferred network, they had just kind of fallen out of the network and nobody was following them at that point. So my job was to hunt down these patients and kind of, talk about our program and, what can we do? Like be another set of eyes on the patient. What does the patient need? How can we get them there? Let's think about discharge planning. Let's think about it on day one. What does the patient need to go home and be safe and successful at home? Because sometimes we can just kind of get in our own little silos and think about, okay, well, I'm just going to work on strengthening. I'm going to work on strengthening. What do they need? At the end of the day, like I've had so many patients that have been, you look at the chart and the chart's just a train wreck, and then you go in and talk to them and you're like, how can I help you as an OT? And they're like, oh, I just need a little bit of help with this, this, and this. I have a caregiver that does everything else for me, but I just need help at this. So it's looking at those patients individually, picking them out of that care pathway and figuring out what's the best thing that you can do for them and what sort of programs and services can you offer them and that you can help home healths and skilled nursing facilities with. Sometimes this helps with good handoff. A lot of times patients are scared about going home and, switching therapists and going to a new setting while they're still, recovering. And this is, looping other services in sooner, having the patient get comfortable with them. And we found it to be very, very successful. So that kind of special teams then morphed into out-of-network management. So now we are a whole team tracking these outlier patients, and I have become the lead of this group. So I kind of look at strategic operations and kind of where are we with our team? What can we do next to help our patients, and what unique challenges are we seeing in the field? So a lot of my day-to-day is spent calling home health agencies or skilled nursing facilities, talking to them about the patient, seeing what the patient needs, seeing if there's any resources I know available to assist the patient in going home. So with BPCI, the bundled payment episode management, it's a 90-day clinical window. So the patient is hospitalized for a CHF exacerbation, that starts the clock. And for 90 days after that, we monitor them to ensure success at home. We have clinical discussions with facilities. Like I said, we increase communication to care settings. We help reduce readmission. So one of our bundles is a UTI bundle, and we had noticed that in one specific partner, hospital, that there were a lot of UTI patients getting readmitted week after week for increased confusion, and they just weren't being successful at home. And it turns out that the antibiotic that they were prescribed wasn't perhaps the best that should have been available to them. So they switched antibiotics, and readmissions were reduced by like 25% within the first month, which was a huge win for the team. And ultimately the goal is for the patient to be successful in their home environment, which is nice. I work from home. I talk a lot on the phone. I talk a lot, via email or over Google Meets with facilities. And, I do travel to some of our headquarter locations throughout the country for various meetings. Our company is a Medicare convener, which basically sits within government affairs. So we have a very, very strong relationship with CMS. Basically, we help different facilities implement CMS's or Medicare's different programs that they create. So, they come up with the program, and then it's up to us to help, different partners implement them across the board. So that's what I do. And then there's a ton of other non-clinical careers out there that you can do. It just depends on what you like, what your skill set is. And a lot of people ask, okay, well, where do I start a non-clinical career path or a non-traditional journey in this sense? And, I have to say, you got to start back at square one. You have to know, what do you like doing and what do you want out of a career and what are you good at? So when I went back to the drawing board, I said, well, the hospital that I was in, because Maryland is the only waiver state in the nation, which means they have a global budget. Everything costs the same across the board, no matter what insurance you have when you go into a facility. And the state says, this is what you get for your operating budget each year. So we had to look at, okay, so if it's a really bad flu season and there's a lot of ER admits, how does that impact the rest of the hospital? How can we look at things and be more efficient in what we do and help improve outcomes at the same time, which is how I pivoted into the job I'm in now. I was very much, we had a huge lean initiative at my hospital, and we just kind of looked at, all right, we're having a problem. What's a strategic way that we can look at it and solve and tackle this problem? So that was definitely a huge building block that I had in the foundation that transferred me over to what I do with Signify Health. The other part of that was my first non-clinical experience with DMECG or Periscope, where I did these, medical necessity evaluations on insurance plans. And that kind of like brought together, it made me this candidate that they wanted as somebody who had a clinical background and had done all these things outside of that clinical treatment model, in addition to my patient care. So that was like the huge, I think, turning factor. And they actually ended up, they were hiring for that PAOS position, but because I had the skill set I had, they had put me on the special teams unit to do this outlier management. And it was something they had been thinking of for a while, but they weren't hiring for it yet. And I just came by with the skill set that they needed at the time. So they kind of made that position happen for me because they're like, oh, this is perfect. And I think a lot of that, activity analysis and breakdown that we do is exactly what I do day to day, and looking at a problem and seeing how we can fix that. So basically looking at your skill set and figuring out how do you change this into more of a corporate kind of hard skills look. And I would say networking is very key. There are a lot of alternative career path sites out there. The biggest one is the Non-Clinical PT. It's a group of allied health professionals, so PT/OT speech. And it's run by a physical therapist, Meredith. She's wonderful. And she actually, she worked at a variety of positions across the field. And she just started writing about all these non-clinical rehab professionals that she met, and she showcased them and kind of just made her own job out of writing about non-clinical careers. There's also alternative careers for rehab professionals. That's another group. that you can join. That one, to be honest, I don't love it as much. There's some group dynamics that can be a little challenging at times. But it's out there and it's a resource to you. Definitely, I'd explore that a little bit. And then the clinician transition is another group, and they talk about, pivoting away from, your clinical skill set, how to move your clinical skill set into more of a translatable field across the healthcare spectrum, because a lot of times these job postings that you'll read the qualifications and you're like, I can do that as a therapist. That's definitely for me, but they want a nursing degree. And there's so many times where they will automatically reject your application because you're not a nurse. So there's been this huge push to educate companies on what we do as clinicians and how we problem solve, and how we can use our skill sets in different ways. Nursing is a great field, but they should not be the ones reviewing our notes for clinical necessity. It should be a therapist. And a lot of agencies are, catching on to that fact now, which is great. And LinkedIn is a great, resource. Just being able to network with people, talk to people. There is that side of LinkedIn that's more of like a social media presence, but just having your profile out there and, marketing yourself and looking at what's available through their jobs and kind of what companies pop up, which is actually how I found Signify Health to begin with, through a LinkedIn post that was suggested to me. So what kind of major companies hire for non-clinical jobs? We've got a lot of major companies. So United Healthcare, and they just bought Navi Health, which is a huge one. Signify, basically anything with a health in it. Look for a health. Signify Health. My Nexus was just bought out by somebody. I can't remember who it was. Aetna, American Specialty Health, CMS or Medicare. Is a huge one. They can hire health insurance specialists. One of my friends who's a nurse applied to them, and she actually worked on PDPM and PDGM when that was coming out. Magellan Health's a huge one that hires a lot of therapists. MedRisk, Blue Cross Blue Shield, Corval Corp, New Motion, Epic, the documentation company, has hired therapists for. Kindred is a huge hiring force for clinical liaisons, Encompass as well. So there's a plethora, and this just scratches the surface, but it's just kind of some names to kind of get on your radar, look into, see what they have job postings. And then examples of non-clinical careers, so case management, and a lot of times you'll see this listed for RNs, but there are companies that hire rehab professionals to be case managers. Navi Health has 6 and HHCCs, which are basically like skilled inpatient care coordinators and home health care coordinators. There's actually a IC alum that was a grade below me or a year behind me, who just started in the home health section. And he's loving it from what I understand. Health insurance specialist, like I said, that's usually a CMS position. So that's a government job, little tricky to get into, just because it's such a long application and getting into the government can be tricky, but great benefits there. Product specialists, a lot of times there are companies that want to sell rehab, certain rehab devices, and they love clinicians who can speak to how to use it. I know Stryker hires some therapists to talk, especially with hip replacements and knee replacements. Like that's a huge thing you can do. I've met a disability service coordinator before, and there was a disability service coordinator hired at a large university who was an OT that I had met, and she was really able to kind of break down what can make things accessible for students when they're on campus. You can be a consultant in whatever field you feel that you're an expert in. Ergonomics can be one where I've seen some, and you can go into office ergonomics. I know that's a huge thing Julie loves and a passion she has. Healthcare content writers, there's a lot of writing positions out there for people who love to write, and somebody who's an expert in the healthcare field, that can kind of be an easy transition to do some PRN work into. You've got program coordinators. I don't know too many program coordinators right now, but they can really just kind of go through, they're almost like project managers in a way, with some more of a product. Project managers manage a product, program coordinators can manage like a whole program and sustainability through various nonprofits. You've got clinical liaisons who really look to generate referrals for whatever healthcare company they're a part of. I had interviewed and almost accepted a position before I accepted Signify's offer to me as a clinical liaison for an acute rehab facility, and helping review insurances and see which patients qualify for a bed at acute rehab. That was cool. Client success specialists. So those, positions are more of, a kind of external facing, helping the client succeed in whatever product you're offering or whatever program you're offering. I actually saw a posting the other day that was specifically asking for therapists and nurses to be special agents for the FBI to deal with healthcare fraud and various situations across the country, which seemed pretty cool. You had to go to training for 6 months and then, moved wherever they station you, but it seemed like a pretty unique and cool role. Not one for me in my point in life, but, maybe when I was younger. Talent acquisition specialists. There are a number of therapists that have moved into the HR realm and go into recruiting and trying to get therapists to sign on to whatever company they're working with. Rehabilitation specialists can kind of be like a broad term, but it's got such like a wide array. It really depends on the company you're working for. And then clinical review specialists, a lot of the times they are the ones that are chart reviewing in basically notes and getting them approved for prior authorization for, additional visits or services, whatever you may need. So that's just a couple of them. But really, if you want to deep dive into this, I would check out the Nonclinical PT's website and then go to Spotlights. And Meredith has done a great job writing about various therapists in different fields and kind of what they do, what their day-to-day is like, what training they've gone through, how did they get into that role. And I was featured probably about a couple months ago, back in the end of January. I was featured, so there's the link to the Spotlights in general. And then if anybody wanted to read that, that's my particular review for Spotlight. And then these are just some of I wanted to quickly go over some of like the main ones people transitioned into. So this is actually one of my students just transitioned into a home care specialist role. She's awesome. She's my best student ever. And she works for Capital City Nurses in DC, which is a private duty home care company. And her agency kind of provides the one-on-one support from a nursing perspective. So she is a therapist. She really talks to doctors' offices and hospitals, cultivates new referrals, and they have her meet with families and really kind of get a sense of what the patient needs so she can set up the proper services within that company to make sure the patient is getting all the value they can out of that service. So she really said interacting with family and evaluating the patient's needs was like her main pull and how she got that job. Utilization review is another hot job that's out there right now for a lot of therapists. These are very highly sought after jobs, mostly because you can work remote and you can work from anywhere. You can pick up and go and it's not an issue. So a lot of the times these will be under therapist reviewer, utilization reviewer, pre-service coordinator, some sort of iteration of that. And basically you're looking at the patient's chart and their therapy notes, and you're helping to determine, does this patient qualify for more skilled visits at this level of care? So, be it a sniff, home health, outpatient, are they ready for the next step in their rehab journey? And then clinical liaisons. So, the main ones for this, like I said, are kindred. And this can be for either, subacute nursing facilities, those SNFs, or it can be for acute rehab, that greater than 3 hours of therapy. And you really kind of have to deep dive through the patient's chart in that case and make sure that everybody who's getting a bed is an appropriate skillable person for that bed, because there are very stringent qualifications for that. So it's really good to be able to be a therapist and read another therapist's notes to understand what's going on with the patient and why they're being recommended to that level of care. Because that's a very costly and expensive level of care, and insurance does not want to pay for somebody to not be successful at that level of care. So it's a lot of, relationship building, cultivating referrals, determining bed appropriateness, keeping those beds filled at whatever facility you're working at. And you're really still part of the interdisciplinary team and working hand in hand. You're just not treating patients, you're helping the patients get what they need, which is pretty cool. So that's basically, in a very small nutshell, scratching the surface on what non-clinical careers can be for therapists. There's still a plethora of things out there. I think one of the things that helped me the most was on the non-clinical PT website, they offer Non-Clinical 101, which is a continuing education course that breaks down pretty much every scope of practice you could possibly think of in the non-clinical realm. It gives you an overview of it, how to tweak your resume to kind of go into that field, what extra qualifications you may or may not need, and kind of some interview tips on how to translate your clinical skills to a non-clinical setting. So what questions does everybody have? I know that was a lot of information to throw at you at once.
Yeah, thank you so much, Larissa. I feel like we could have a whole session on any of those jobs you just listed.
I could literally spend a whole day breaking down the job of, okay, this is what, UX does, because user experience is like a huge thing as OTs we could go into. But it just takes a lot of time to review all these things. So I feel like I could spend a whole day teaching.
Yeah, I'm sure I can tell we're just barely scratching the surface. But with that, if anybody does have any questions or wants to go a little bit deeper into any of the topics, again, feel free to unmute yourself, share in the chat. Larissa, if sharing your screen would make seeing the chat easier, you can feel free to do that. Thank you again for jumping in there when my internet decided to stop working.
Yeah. No,
but yeah, any questions, please feel free to ask.
I have a question. So I know you mentioned right there at the end something about the like a continuing ed course. So with most of these jobs, and apologies if you mentioned this already, but would you have to get some kind of deeper training most likely in some of these, or is it kind of more like learn on the job a little bit with the skills we have, or like as OTs already kind of thing, just because
that's a great question.
That seems scary of like corporate world.
Yeah, no, corporate world is a whole different entity. Yeah. So I did not have to do any additional training or skill set. It was all of my diverse background as a therapist. And this is one of the reasons when I talk to newer therapists who are out in the field and they're like, oh, I'm really interested in a non-clinical role, I'd love to apply to that. And I'm like, no, not yet. Work in a whole plethora of different, practice areas. Get seasoned, because you're going to learn so many things in each different practice setting that it's going to help you apply to that position later on and really be like a seasoned expert. And you're going to have a huge, complete view of the healthcare system. Unless you really know what you want to do and you hone in and you laser focus. And, there are some roles that you would want to go back to school and get an additional certificate or, something like that along the way. And that's really job dependent in a lot of ways. But what I do now, I did not take any extra courses other than that non-clinical 101 that just taught me how to tweak my resume just so it wasn't auto booted out of the ATS system, and like how to basically mirror some wording and rephrase what I was doing so that people understand from a corporate perspective kind of how I have those skills. We might not say them clinically, but we all have those skills and backgrounds as therapists out in the field. We all do discharge planning. We all manage tough cases. We do so much, and the world really doesn't understand it in a way. So how do you pivot and have people understand what you do in a clearer perspective with your skill set, rather than just treating a knee replacement, or just treating a post-op spine, or just treating a kid with CP? They think narrowly like that, and you're saying, no, we have so much we have to offer. And I think because nursing, they have such a large force, they have such a large agency, they have a lot of nursing agencies behind them that advocate for them. They tend to get a lot of these non-clinical roles. So it's making companies understand, okay, a nurse can do this, but here's what a therapist can also do. And here's why I think I'm the right person for this role. So I know it's kind of a long-winded answer, but yes and no is basically the long story short. It kind of depends what you want to do and where you want to go with that.
I have a question.
Hi, Larissa. Go ahead.
Nicole, no, totally go. I'll go after you.
Okay, cool. So I actually found myself in a similar position in a saturated area with like 4 or 5 PRN jobs about 2 years ago. So I started exploring this route a little bit. I was applying to everything under the sun. And one of the issues you mentioned already, that idea that like a social worker or an RN is what they're looking for. So that was one barrier you already addressed. Another barrier I found is not being satisfied with the pay. So the idea of switching, being used to a full-time OT salary and switching to a non-clinical role, at least some of the roles that I did manage to get a call back from, it would have been taking a really significant pay cut. So without totally invading your financials or your privacy, I'm curious if you found, like, is there an initial pay cut and it's worth it because there's actually, a ladder there, as opposed to like in the therapy field where you are is kind of, where your salary stays. I'm just curious about your experience.
That's a wonderful question. Yeah. And I interviewed for so much under the sun during that pandemic time. I put out like 300 applications within the course of 6 months. I feel like I was applying for everything under the sun. And some of them, were pay cuts that I was like, no, I can't take this. Although I make more now than I did as a therapist. So I think it kind of depends on the company and what you're looking at. Like sometimes you might need to take a tiny step back if there is a career ladder within that company for you to advance. And I think a lot of times as therapists, like we hit that ceiling. There's only so many management positions out there. Do you really want to do management for a company, or do you want to use your skill set in a different way, which is challenging? So kind of I went through a whole bunch of different things, and like the clinical liaison position I almost accepted. That was going to be a PRN position that they were going to offer me full-time hours to justify a new FTE. But then when they justified that, they wanted to bring it back down to a salary position, which would have been not a ton lower, but still like, a little bit lower than what I wanted. And then I was interviewing with Signify at the same time. And, it got me a very decent pay raise, which helps. And I have bonus potential and I have room to grow. I had a meeting with some of our executives and VPs of what was going on in our department, and they just kind of confirmed like, you're going to continue to grow, and in 6 months this is where we think we see you, and the promotions that you're going to get, and here we can promote members of the team to these various aspects. So I think it really depends on the company and what feels right to you and kind of what you see as valuable. Because one, like, when I first started in the company, yeah, it was a pay raise. Was it as significant as I have now? No, but it was still a pay raise. But I wasn't driving my car like, hours and hours and hours at a time doing home care. I was eating at home. I wasn't buying scrubs every 6 months because they were getting worn out from the ICU and being, completely destroyed from the hospital, or, oops, I got to buy a new pair of tennis shoes because there was a code brown and my shoes took the hit on that. So I bank a lot more than what I had previously banked because my expenses are a lot less and I also had a pay raise. So it just depends on the company. And I would say when I was going through that, sending out application and I was getting lower ball offers from some places, it was very frustrating and like you kind of want to give up, but eventually something breaks because you learn how to interview for corporate jobs. By that point, I was like, just by the end of it, I was a pro. I knew exactly what they were going to ask. I knew my responses. I knew what questions to ask. And it just turned up finding the right company at the right time that kind of jives with your sense of purpose. So.
Okay, cool. Thank you for sharing. That's like refreshing to hear that it was equivalent, if not more, because that was definitely just something to me.
Yeah.
And this jump is scary enough to make you're like kind of ditching, you're still using the skill set, but you're ditching your, master's degree, your certification. So it feels like a scary jump. And then you're like, oh, I'm taking this jump and I'm taking this $20,000 or $30,000 pay cut. It just feels like,
I would say where I'm at, I was probably at about a 10 grand raise and then I pivoted up more. So and there's still potential to grow. Yeah. And I used to up until recently when I took the lead position, when they were like, all right, we're going to make your department like an actual department rather than special teams. I used to still PRN for the mobile Med B clinic in our area because, as the healthcare world turns, sometimes in rural areas, it's hard to find therapists to treat certain conditions. And because of my background, I was kind of the expert in certain conditions. So I would keep, a handful of 2 or 3 patients that I would just see throughout the day. And my job's so flexible that I can just block out time throughout the day, go out to do a doctor's appointment or, do something at my daughter's school, or say, I'm going to start work early and then end work at 3 so I can go see Mr. Jones down the street. I used to do that, but now since I'm the lead for our team, I've kind of stabilized my hours a little bit, and I still do block out my time to go to doctor's appointments and my daughter's stuff, but I did let the treatment portion of it go for now.
And if you keep your OT license current?
Yes, I keep my OT license. I keep my board NBCOT. Just because you never know when you're going to need it. I worked hard for that. I paid a lot of money for it. And we are actually probably moving back to Maryland within the next couple of months. So Maryland's system is, as long as you keep current with NBCOT, they're fine. They don't really check your CEUs. So I'm just going to keep current with NBCOT, keep my Maryland license. And in case I need it in the future, you never know what kind of director position might, want you to be clinical and have your degree. So
Thank you.
You're welcome.
I just want to jump in for a second. I think Jenna has a question, but Larissa, could you maybe stop sharing your screen?
Oh, sorry.
That's okay. So we can see faces.
I have like a million.
I know. I was thinking you could probably see our faces, but we couldn't. So
yeah.
Okay, thanks. Sorry.
No worries.
Yeah. So Larissa, thank you for that. That was so informative and so enlightening. And I think broadening our understanding of what can be done beyond, what students, typically understand and learn about. And, even for me of wow, there's so much that you can do with your OT skill set, and being creative with that. So your conversation with Nicole actually was very similar to the question that I had. And I think this piggybacks off of what you were talking about in terms of like your growth and kind of your next steps. And, you know, I heard you just mention perhaps moving back to Maryland, but yeah, I was curious, you know, you've done so much already, so many, you know, amazing positions in different companies, and, you know, wondering what's your 10-year, what's your 15-year goal? Like, where do you, does this
Okay.
feel like a job interview? I'm not intending
No,
that.
it's
but I'm
good. It's good.
curious.
I do have a plan. So, aside from speaking at every alumni speaker presentation for the next 10 years and talking Julie into letting me do a full day presentation on non-clinical skill sets, we are actually, so my job's remote, and we really struggled when I left the hospital because my husband got a job in North Carolina, and then we had to move back up to Pennsylvania because we had a family member that was sick, and I couldn't keep quitting my job. I was like, no, I'm not doing this, and I'm not going to start at the bottom rung of a ladder with an organization to work my way up again. It would be boring to me. So I get to keep my job wherever we move. If I wanted to go home to New York for a week, I can bring my laptop and do what I do. And we're kind of, it's very strategic, kind of our move back to Maryland, because it puts me right where CMS is. Our company has such a big relationship with Medicare. You know, we implement their programs that I could see, you know, myself working up in the company that I'm in. And our company does so much more than episode management. We are just one vein within the company that I can work my way up. That, you know, should I ever decide to leave this company, I would probably try to go work for the government with Medicare, because I firmly believe, and this is kind of just my motto, is with the way that everything changes in healthcare, therapists need to have a seat at the table, and they need to have their voice heard. So that was kind of like my driving factor to be like, yeah, I'm gonna go non-clinical, and I'm gonna make a change in healthcare that I see that makes sense. And people need to understand, like from a therapist point of view who are treating these patients, you know, kind of what goes on, and we need to advocate, you know. So that's kind of like my 10-year plan. I'm going to move up in the company as much as I can. I love my company. I love my leadership. They are very, very supportive of me. And as a therapist, you know, I was brought on to kind of help formulate this out of network management. And they really didn't think it would take off in the way that I did. But because I had such a strong lean background, and I was making, like, you know, standard works and process improvement ideas, and, you know, outlining various policies for our group, and I just kind of dropped them off on my, you know, executive's virtual desk, and she'd be like, how do you know I need all this? And I'd be like, task analysis. That's what OTs do. Like, I know what you need, and I know the next steps, and I'm anticipating that. And here's, you know, where I see things. So I'm going to work there, and then I'm going to try to get a government job.
So, were you going to say something, Jenna? Okay. I have two questions. The first one was just, like, out of all of the different settings that you've worked in, what was your favorite? And then my other question was, kind of like, with this more responsibility and leadership, do you feel like that takes up like more of your time, and like balancing that with like life?
Yes, that's a good question. I would say, you know, if you're in terms of work-life balance, I have a fantastic work-life balance right now. Last year I put in for the week between Christmas and New Year's off, which I'd only used to get one day approved around the holiday, Thanksgiving or Christmas, one day between then in healthcare, just because of how patient care needs are. I took the entire week. I hung out with my daughter. I baked some cookies. Like, you know, I have unlimited PTO, and I have great benefits with my company. I have full paid maternity leave for like a gazillion number of weeks. So like my leadership role, yeah, sometimes I work a little bit later at night because there's something that needs to be done and I'm home, but that's because like I want to do it. and I want to get it done. But it's really not the norm, and it's just something I kind of like pop on to do. And then what was your first question?
Oh, I was just wondering if you had like a favorite setting that you worked in.
Right. So I really loved my job at the larger hospital system I was at in Maryland. I became like the primary orthopedic therapist, and I translated that into upper extremity trauma. And I kind of did a bridge system between working inpatient and outpatient, so I could do inpatient upper extremity trauma and then do outpatient hand therapy in the clinic. And I really enjoyed that. That was seeing patients get better is really, really nice, because sometimes when you work in the hospital, you don't see things get better. You just kind of see like, everybody at their worst, and that can really grate on you. Oh, you're in Maryland? Nice. So I worked in Annapolis, and I'm sure if you can look up and see which hospital that is, but yeah, I really enjoyed my time there. And the fact that Maryland is a waiver state and there are so many hospitals there, there's so much opportunity for therapists there. Expensive, but hey, you get paid pretty decently.
I think we have time for maybe one more question, if anybody has anything coming to mind.
I'm gonna hop in because I want to comment a little bit on the advocacy component. I mean, I heard you say the word once, but everything you're talking about is advocacy in terms of, having a seat at the table, the voice for OT, being able to look at our professional skills, not clinical, but like professional, and what we bring to the table, and how re-envisioning that for these different roles, I think is just phenomenal. And I just want to kind of name some of that as advocacy for the profession, and how there's always going to be a role for OTs in direct care, direct patient care, one-on-one, always, absolutely. And if we look at population health and what is happening, I feel like so much of what you're talking about relates to population health in a different lens, right? You're not out running programming, but you're supporting population health through the work that you're doing. So, I just love hearing the model and hearing you talk about it and your passion and moving up in CMS. And I wasn't surprised at all that, of course, you have a plan. When Jenna asked it, I'm like, of course, Larissa's going to have a plan and an answer, right? Of like a thoughtful way to really think about your future. And I also love that you center work-life balance and your family, and just sort of a model for everybody to think about. And hearing you say, putting out all of those resumes and not giving up, not feeling like you had to settle. I think that is a nice piece of the story as well, even though I'm sure it was incredibly
very hard time with COVID. Yeah. And I think I remember I had spoken to the students at one point during COVID. It was me and Janessa. And we were just kind of talking about like, yeah, we're with the COVID pandemic right now, like companies are reducing hours, we're just piecemealing time together. And I was just putting out resume after resume and just hoping, and it gets you down. But in the end, like everything that happened, I wound up at the company I think I'm supposed to be at for my career, and my what really like where my passion is in healthcare and fixing healthcare and making it more client-centered. Versus doing things to people and getting paid to do things to people. I want people to be home and happy. And that's our company's motto, is happy, healthy days at home. So really looking at that, it's a huge driving factor of why I took that job. And it was a bonus that it was a big pay raise for me. Like I love it. So I am always happy to talk about more non-clinical life. You just give me the time, I'll put it on the books and block my schedule.
You got it. Got it.
I think that's sort of the perfect note to end on. I do see that we are coming up on time, but thank you so much, Larissa. Just a couple of days ago, I was trying to explain to somebody what I like to call like the OT brain, and how OT brain can do everything. And this is OT brain. You can do everything, and it's absolutely amazing to see one of our alums putting it all to work. So thank you so much for being here and for all that you're doing. As a reminder, we will be providing the transcript and posting a recording to the Canvas site. And next week, we have our last speaker series of the year with Brianna Shantz on May 5th on OT's role in low vision rehabilitation. So we hope to see you there next week. And thank you again all for being here. And thank you, Larissa. Have a great night, everyone.